Hi, so you're very welcome into theatre. This really is the most important place of the hospital from a surgical perspective. And you'll see really how we look after patients very well here. The Mater Hospital, of course, is a really special place. It's been looking after patients for nearly 150 years. And it's a privilege to work here, and I hope you guys enjoy your time here. When you get into theatre, the most important thing is you just respect that it is a place of work, where the patients are the most important aspect of it, and making sure that the staff and all of us look after the patients as best as we possibly can. It's a university hospital. Teaching is important. We all have to learn through experience. But just be aware that it might be slightly new to you. Don't rush in. Smile and introduce yourselves to the staff. Be respectful that there will be some procedures and protocols that are all there for a purpose, but that you mightn't know instantly about. So just relax and enjoy it, and make the most of this really special educational time, and this very important time to make sure our patients get as well looked after as possible.
Hi, I'm Helen Mohan. I'm the surgical tutor at the Mater. Theatre is a great opportunity to solidify your ward and book learning and to truly understand the surgical patient journey. To get the most out of your time in theatre, find out the day before from the team what the name of the patient coming in for surgery is, what the operation that is proposed is, and where the patient will be and when they're coming in. Try and find the patient preoperatively to take a history, as this will greatly improve your understanding of the case. Read the day before about the patient's underlying condition, the proposed operation, the risks, benefits and alternatives to the operation, and the underlying relevant anatomy. This will greatly improve your understanding of the case. If there are several medical students in theatre that day, decide between yourselves in advance which case each of you is going to ask to scrub for, and ask the operating consultant or registrar for permission to scrub in the case in advance. After the operation, reread your notes about the patient's condition and correct any elements that you had learnt during the case. Post-operatively, follow the patient on the ward and check with the team if there's any element of the post-operative care that you don't understand. Remember, we're all here to help you understand your experience in theatre.
Hi, my name is Lorcan O'Carroll. I'm one of the senior house officers who works for the colorectal service. In order to see patients preoperatively who are having same-day admission, you will need to be familiar with the scheduled care ward and patient transfer units. The scheduled care ward is located in the first floor of the old hospital. Patients are admitted to the scheduled care ward who are undergoing day case surgery or expected to have an overnight admission. Major cases are sometimes admitted to the scheduled care ward preoperatively, but will be transferred to another ward postoperatively. Major cases are also admitted to the patient transfer unit, which is located beside the Freeman Auditorium on the ground floor of the old hospital. It is important that you should attend these wards early in the day, around 7 a.m. You should accompany the team intern or senior house officer who is tending to admissions on the day of surgery. Seeing patients preoperatively will allow you to enhance your experience of operative surgery, will expand your understanding of perioperative medicine, and will ground your academic knowledge in clinical and personal experience. Above all, enjoy your interaction with patients. Good luck.
Hi everyone, I'm Naomi, one of the surgical registrars in the Mater Hospital. I'm going to be talking today about coming into theatre, where to stand and what to do when you're in there. So first of all, number one importance is patient safety. Everything that takes place in theatre is for a reason. Before you walk in, make sure you know what theatre you're going into, which consultant is operating, make sure you're wearing the right clothes, and make sure you know which patient is going in. When you're in theatre, pick a safe spot in the surgical area out of the way initially. When you find a circulating nurse who's free, you can ask them where is the most appropriate place to stand. When it comes to the time-out procedure, Make sure you listen to each and every rule. This is very important, and make sure that you identify yourself as well as one of the UCD medical students. When the procedure starts to take place, you'll be able to move closer to the operating table. However, be sure not to contaminate the surgical area and stay away from the sterile field. You will know where is sterile as the patient will be draped with green drapes. If you're unsure, again, make sure to ask one of the nurses. They will always help you. Good luck with everything.
Hi, I'm Niamh and I'm a surgical intern. Here are some practical tips for your time in theatre. Although you will already know the members of the team, remember to introduce yourself and your role as a medical student to the other members of theatre staff, including nurses and anaesthetists. Switch off your mobile phone. It's important to remember to protect patient confidentiality. You're not allowed to discuss your time in theatre on social media, Facebook, Twitter, etc. Many students feel anxious about feeling faint in theatre. It's really important to remember to eat your breakfast before you scrub in. When standing, try and use your calf muscle pumps to avoid feeling syncopal. If you do feel faint, it's important to say that you feel faint, to step away from the operating table, sit down, put your head between your knees and remove your mask. Remember, most of your consultants and the other members of your team will have fainted as medical students. There's nothing to be embarrassed about. And just remember to enjoy your time in theatre.
Hi, my name is Catherine Kenny. I am Theatre Secretary in the Theatre Department. I would like to welcome you to the Theatre Department. All visitors, including medical students, must sign in with the Theatre Secretary on arrival and adhere to the Theatre Visitors Policy, which is on display in the Theatre office. All medical students, when signing in to the Theatre Department, must include their full name, mobile number, date of visit and the theatre that they are visiting. And you are most welcome to the Theatre Department. If you have any questions, myself and my colleague Kathleen Cuff are here to help you.
Hello, my name is Kathleen Cuff. I'm Theatre Secretary here in the Mater Public Hospital. We give clogs to all our medical students. There's a form to sign in for them and to sign out. So when you're signing in, please date it, your name, your mobile number, the area you're going to, the size and colour you're taking. And then when you return them, just circle yes. And that way we will always have an availability of clogs here for all the students. Please fill out a visitor sticker and put it on your scrubs just to identify yourself to all the staff. We have a visitor's key for the scrubs press, and that is for the UCD Navy scrubs, and they are situated on the 4th floor in a press. And you just take that, and when you return them, remember to put them in the bin there. We're here, Catherine and myself, for any help you need, any directions to theatres. We're happy to help you. And please don't forget to put a hat on you and a mask going into theatre. Thank you.
Hello, you're very welcome to the theatre here in the Mater Hospital. My name is Louise Crehan. I'm the Clinical Nurse Manager 3, the theatre manager here in the theatre department. So as part of your orientation, I just want to inform you of a few things that are very important while you're here in the theatre department. So at this stage of your journey in theatre, you will have now signed in, you've met the theatre secretary, you've signed in, you've got your theatre attire, you've got your scrubs, you've been assigned your lockers, and now you're coming down to the theatre from the changing room, and you're coming to the theatre that you're assigned to, where you're going to be working and observing with the surgeon, consultant surgeon, and the surgical team of whatever theatre you're assigned to. So at this stage, I would just want to tell you a few things. You've all heard about the house rules, so I'm just going to tell you about a few theatre rules that are important in theatre. So first of all, and you've probably been told about these before, mobile phones is very important that you have these turned off or put on silent. It's very important that you don't take any photos using your mobile phone while you're in the theatre. You should have your ID on at all times. just so that if somebody comes along and asks you who you are, that we know who you are. So to have your ID on. And this is very important, to have your ID if you have to leave the theatre department to exit or entry. So if you're going for a break, make sure you have your ID badge on at all time. So a very important part of your theatre attire while you're in theatre is that you have your hair covered with your hat on you, that your mask, you put a mask on when you're coming into theatre, especially for during procedures, you have to have a mask on. And it's very important that your mask is on properly, that it covers your nose and mouth. Now there's different types of masks in theatre for different types of procedures and for different infection reasons. So it's important that you know which type of mask to wear, and if you're not sure, just to ask the person in charge. They will explain to you anyhow on the day what mask you should be wearing. So it's very important that you have your mask on properly, and then when you're leaving the theatre department and going out for a break, that you go and take your mask off, dispose of it in the proper clinical waste bag. So when you come into the theatre, this is the individual theatre you're probably assigned to for the day. This is the inside of the theatre. So it's very important when you come in first to the theatre that you introduce yourself to the clinical nurse manager or the person in charge of the theatre for that day. So they know who you are or how many of you are coming in to observe the surgery for the day. So I'm just going to show you a few important points for the theatre here and lay out a few things for you that you need to be aware of. So first of all, we have the theatre itself. You have the operating table here, which is over here, and you have the anaesthetic screen at the top end of the table. The anaesthetists will be up at the top end. You'll have the surgeons at either side of the table. This is just set up very simply for simple procedures such as an appendectomy. You have the operating trolley here and the setup field, so the scrub nurse will be behind her scrub instrument trolley. You have diathermy machine, you're going to have suction machine. Over here, this side, you have the scrub up area, you have the swab rack. You see here monitors and panels on the wall. So the NIMUS, where they can view the CT scans and X-rays. You have your monitors and clocks for turning on your lights, operating lights for your ventilation. You have your work area for the nurses and for the doctors. You'll notice there's two computers. One will be for the nurses, that they are able to check if patients are ready, send for patients, and then the doctors have their own one to do up their op notes and to check for blood results, and you have also the register. So that's the kind of workup area. So at the top of the table is the anaesthetic area, and you have your anaesthetic trolley for extra bits and pieces that the anaesthetists might need, so they don't have to go into the anaesthetic room back and forth all the time. While you're in theatre, you will notice there's certain doors in theatre, exit and entry doors into theatre, that you need to be wary of. So I'm just going to let you know, this is the main operating door, and it can open fully and it can open partially. And at the end of the procedure, the patient goes out through this door. Now it's very important during procedures that you don't go through that door yourself. That door should not be opened during procedures. This door here is the door into the prep room, and this is where the nurses will set up for procedures advance of the surgery. So they can set up their sterile field here. The circulating nurse will open up the instruments and any extra bits and pieces that they need for the procedure. So that's the prep room area. This door here is the anaesthetic room door, and this is where the patient will be in for the anaesthesia part of their surgery after they come down from the holding bay. Now it's important to note that you see there's knobs here in the door, and it's important that you know about these. So the green knob is for the full opening of the door, and the white knob button here is for partial opening the door. Why we have a partial opening of the door is so that if a patient was in the anaesthetic room while this procedure is happening at the time, that the patient that is maybe not asleep does not see what's going on inside. So that's why we have the partial opening of the door. So it's very important if you have to exit in a hurry and you should not exit through this door if there's a patient in here. You should not exit this door if they're prepping and setting up for another procedure. So the other door that you could exit is this door, which is the dirty utility room door. So at the end of a procedure, all the instruments and equipment and positioning devices all come into the dirty utility room to get cleaned and then be sent down to CSSD. So these are the main doors into the theatre and out of the theatre that you should be aware of. So as I mentioned earlier, when you come into theatre first, hand hygiene is very important, that you do your hand hygiene. So this is the scrub up area. So you can do your hand hygiene in here, in the sinks in here. And these are sensor taps here, and the water will come on automatically to do your hygiene. So if you're asked to scrub up for a procedure, it's very important that you've already been trained on how to scrub up properly. There is a hand hygiene technique. It's a 5-minute technique. There's certain steps that you have to adhere to while you're doing your scrubbing up technique. So it's very important that you have already been trained in your scrubbing up technique before trying to do any scrub up. This is the scrub up trolley here. So again, this is a sterile field area, and it's very important that this is not contaminated. So again, when you are scrubbing up, that you maintain your sterility at all times. And if you need a special pair of gloves, that you ask somebody to open them for you. So this is the scrub up area where the surgeons and the nurses will scrub up for all the procedures. And you'll see all your scrubs, packs here, gown packs, all the various different gloves and solutions and eye protection and extra masks there in the scrub up area for you. So this is your sterile field. Here, the operating table, you have your instrument trolley and your Mayo table, and you have your other bits of equipment here beside the instrument field. Very, very important that you do not go near the sterile field when a procedure is happening. I know you'd like to see as much of the surgery as possible, but it's important that you stay at least 1 foot away from the sterile field. Because if you have your ID badge on, you could very easily hit off the sterile field, or if you had a book or something like that in your hand. So it's very important that you stay away from anything that's green, or if any of the surgeons have their sterile gowns on. So sterile field is very important that you do not contaminate that while you're in the theatre. So now that I've explained the sterile field a little bit to you, another important aspect to remember is your spatial awareness while you're in theatre. As you can see, there's a lot of pendants, there's a lot of equipment, there's monitors, there's operating lights, there's anaesthetic equipment, and there's leads trailing on the ground, there's bins, there's blood racks. So there's a lot of bits and pieces in the theatre that you need to be aware of, that you do not get an accident if you hit your head off. So if you're moving around, just be aware of these things in your area. One very important thing is that the operating lights is part of the sterile field, and you will see that there is covers put on these lights while the surgery is going on. So if you happen to be the only maybe person, if somebody stepped out for a few minutes and somebody asked you to move the light, it's very important that you just don't grab the light to move the light. It could be an instinct that you might want to move the light, but don't move the operating light, because that is a sterile field, part of the sterile fields. So just to stay away from the operating light if you can. I just want to show you about this is the teaching monitor. And again, these are quite low lying. So when you're observing surgery and people are moving around maybe beside you and they're telling you maybe to move out of the way just for a few minutes, if they're trying to bring in extra equipment or sets for a procedure, just be careful that you don't hit your head maybe off monitors, or you don't want to go away with a scratch in your head or trip on trailing cables. So this is the work area for the nurses and the doctors, and you see there's 2 computers here. So one is really for the nurses to check if patients are ready, to send for the patients, to check results, and also then you have one for the doctors to be able to check results, to do up their op notes afterwards on patient center, and to look up order tests and whatever else they need to do regarding the patient. And you also then here have the patient register. So it's very important while you're a student here in the theatre that data protection and patient confidentiality is adhered to, and that any items that are discussed within the theatre should not be discussed out in the lifts, in public places, tea rooms or corridors, so that we're maintaining patient confidentiality at all times. So while you're a student in theatre, this is a working area, so you'll see a lot of other disciplines working in the area. You'll have your anaesthesia team, you may have radiographers, you'll have the nursing staff, you may have reps coming in to help and assist if there's certain surgery that needs implantation in. You will also maybe have visitors from other hospitals as well as yourself, students here. You could have nursing students. So there could be a lot of people in the theatre at any given time. You'll also have porters coming in and out, transferring patients in and out of theatre. You'll have household staff who come in and out and clean the operating table in between cases and the positioning devices. And then you will have cleaners as well at the end of each procedure who have to clean the floor and get ready the theatre for the next procedure. So just a little word of advice, while cleaning is going on, I would advise you to step outside the theatre to allow cleaning to take place properly, because at this stage the floor can get very wet while the cleaners are in progress. So just to step out for a few minutes before the next procedure so the cleaners can do their job, because the floor can get very wet and we don't want any trips or falls on the floor at this stage. So again, we have a lot of people in theatre. It's a working environment. The circulating nurse and the other nurses, there'll be people moving in and out all the time. As you know here, as you can see here, there's not that much space, you know, for people to move around. And if nurses are asked to get another set in a hurry, they need to have that space to be able to get in, to open up. They may have to bring more trolleys in and out. So it's important that you just always step back out of the way to give them the opportunity to be able to open up their sets in a sterile way, that people are not going to be bumping off things and tripping over things. So if you're asked to move out of the way in a hurry, just don't take it as offence. It is just, it's a working environment and people have to be able to do things in appropriately timely manner. So just again, always be aware of what's happening around. And sometimes, you know, if emergency situation was to happen in theatre, say for instance the blood pressure drops, there's a lot of blood required, maybe extra equipment has to come in, defibrillators, cardiac arrest trolley. It's very important that you do step out of the way to allow those people that are trained in that area to be able to do what they have to do, and they're not going to be hampered in any way. So again, you always be vigilant of these things that can happen at very short notice. Another important thing just to point out is fire safety. If alarms go off in the theatre, it's important that you do follow any instructions that's given to you by the person in charge. You may have to leave the theatre, you know, immediately. So again, it's very important. One other thing just to let you know is if you were asked to scrub for a case and you did inflict a needle stick injury at the table, that you do report that at the time, because you would need to get there's a needle stick injury pack, there's a proper procedure that has to take place, and you would have to go down to Occupational Health Department then afterwards. So it's very important that you report that if you were scrubbed and you did get a needle stick injury at the table, that you report it to the person in charge and you let the team know. So these are just a few things that you need to be wary of while you're inside in the theatre. So this is the anaesthetic area where the anaesthetists will be at the head of the table, And sometimes you will have the screens up here, the sterile screens, to protect and maintain sterile field. And sometimes they can be up lower than this. But at all times here, this is the anaesthetic area, you have the anaesthetic machine. There could be a lot more monitors here, sometimes extra equipment if required. You'll have rapid infusers, more maybe drips. You have the anaesthetic trolley here is used by the anaesthetists so they don't have to go in and out all the time to the anaesthetic room to get extra infusions or extra drugs. Always you have your clinical waste bin for any sharps here, so it's very important that this is here at all time beside the anaesthesia area, because they use a lot of drugs, a lot of needles. You have hotlines and different monitors. So this is the area for the anaesthesia, and again, you know, if you're in theatre, just be wary of what they have to do, like, and sometimes things can happen in a hurry that you need to be able to maybe move out of their way to allow them to do their work in a proper orderly manner. So now that you've been given this little snippet of information regarding the actual theatre while you're inside of the theatre, you've been given a little information about the operating table, the sterile field, you know, your spatial awareness, all your different monitors, so just being aware of what's happening in theatre, all the different disciplines in theatre, the different working areas of the theatre. You have the scrub up area. You've been told a little bit about how to enter and exit. You've been told about the operating working environment of the team and the nurses. You've also been given a little bit of information regarding you know, rules within theatre, mobile phones, patient confidentiality, hand hygiene. So all these little bits of information is very important while you're here as a student in the theatre. And I just want to take this opportunity to hope that this experience for you is a very enjoyable and pleasurable one, and just want to wish you all a very good experience here in the theatre, and wish you well for your future career. Hopefully you'll be back to us as future surgeons in years to come. So thank you, and I hope you have an enjoyable experience here in the theatre, students.